Hello, my name is Kelsey Tinker, and I am going to be discussing post-traumatic stress disorder, or PTSD. Now, PTSD is characterized as a mental health disorder, and it's a biochemical change in the stress response within the brain. Now, the cause of PTSD comes from experiencing a severe trauma, and that severe trauma can include things such as an airplane crash, or being in war, or possibly child or adult abuse. Now, the symptoms that come along with PTSD are categorized. So you have the intrusive symptoms, which can be a flashback or a nightmare, and both tend to be very vivid and very detailed. So they can be for the patient just like experiencing the event all over again. Another category would be avoidance, and that includes someone who is emotionally numb. They tend to not connect with other people and situations, which can negatively impact their relationships that they have in their life. Another category where you see the symptoms would be hyperarousal, and that includes someone who is extra irritable, or they could have a sensitive startle response. They could be overly anxious. They could be severely depressed, and they can also be overly concerned with safety. Now, the pathogenesis for PTSD is complicated. It doesn't occur in just one key group of people or from one event, and there needs to be more research into what could predispose someone to PTSD, or how to better treat it. Now, a doctor will diagnose PTSD in someone through different physical tests, through a psych eval, as well as using criteria from the American Psychiatric Association. And for someone to be diagnosed with PTSD through a doctor, they need to have that triad of symptoms for at least a month. Now, whenever a doctor does diagnose someone with PTSD, they'll use certain tests to do that, and that includes a clinician-administered PTSD scale, where they do that within an interview, but also patients can do self-reporting or use self-report instruments to do that, as well as a doctor can use a brain scan to have a better idea of the brain structure and the blood flow, not necessarily to diagnose someone. Now, with PTSD, there are complications that can happen, and if someone is diagnosed, they tend to have increased rates of exposure to other mental health disorders, and that could be a mood disorder, panic or anxiety disorders, that could be other neurological conditions, that could also be an exposure to substance abuse, social and relationship issues, possible job loss, and there are the cases where it does lead to death. Now, that sounding somewhat grim, there is a positive prognosis with PTSD, and that comes with doctors using a multitude of different methods to treat patients that have this. There's medication that's used, as well as different psychotherapies, and that includes trauma-based, cognitive, certain eye movement, reprocessing treatments that retrain the brain to use its new techniques to understand and reprogram itself to understand that trauma differently. There's also certain other cognitive behavioral therapies that are used, as well as physical therapies. And with all of those therapies, there also needs to be a high level of participation of the patient to make sure that prognosis and that outlook for that patient is positive.